Session 6, Impact of Birth Practices. After completing this session, participants will be able to discuss the importance of early contact and the initiation of breastfeeding, describe the procedure of placing the baby in skin-to-skin contact immediately after birth, explain how a baby moves to the breast and attaches by themselves and how to help them if needed, and describe how healthcare practices affect initiation of breastfeeding. Requiring a mother to lay flat on her back during labor and delivery may cause a mother's discomfort and can impact her ability to initiate breastfeeding. The lack of support, which is one of the greatest or biggest key to early initiation and continued breastfeeding, and lack of it during labor and delivery can cause a delay in breastfeeding. Withholding food and fluids during labor may cause mother's fatigue and dehydration, which has an impact on the ability to initiate breastfeeding. And giving pain medications and interventions for the mother will have an effect on baby's alertness and ability to breastfeed. Wrapping the baby tightly after birth may deprive the baby from using, Wrapping the baby tightly after birth may, Wrapping the baby tightly after birth may inhibit the babies to use their natural reflexes and movements to begin breastfeeding within the first hour. Separating the mother and baby after birth may lack Repeat. Mother and baby need to be together to breastfeed early and often, such as, Mother and baby need to be together to breastfeed early and often. Separating the mother and the baby after birth can impede the initiation of breastfeeding. We know that the evidence is solid, and the following newborn care practices will save lives. We know that the following evidence is solid and that the following newborn practices will save newborns' lives. Unang yakap or yakap ng buhay has 4 important steps. 1, immediate and thorough drying. 2, early skin-to-skin contact. 3, properly timed cord clamping. And 4, non-separation of newborn from mother for early breastfeeding. Early skin-to-skin contact between mothers and infants should be initiated as soon as possible after birth. It should be uninterrupted for at least 60 minutes, and mothers should be supported to initiate breastfeeding as soon as possible. According to research, babies who start to breastfeed within the first hour are more likely to survive the first. According to research, babies who start to breastfeed within the first hour are more likely to survive the first month of life. The longer they delay, According to research, babies who start to breastfeed within the first hour are more likely to survive the first month of life. According to research, babies who start breastfed, Early skin contact between mothers and infants should be initiated as soon as possible after birth. It should be uninterrupted for at least 60 minutes, and mothers should be also supported to initiate breastfeeding as soon as possible. According to research, babies who have started to breastfeed within the first hour are more likely to survive the first month of life. The longer the delay, the greater the risk of death. Early skin-to-skin contact Early skin-to-skin contact promotes bonding, maintains warmth, and lowers infection and mortality. Benefits of early skin contact are as follows. Allows the baby to find the breast and self-attach, helps mother and baby bond. A mother will more likely to start breastfeeding and will continue for a longer period of time. helps stimulate maternal milk production and supply, calms the mother and the baby, helps regulate the baby's breathing, heart rate, temperature, and glucose levels, which is especially valuable in low birth weight babies and premature babies. It also enables the colonization of the gut of the baby with microbes from the mother's skin, mucosal surface, and intestines, which helps protect the baby from infection. In this picture, the baby has been placed on the mother's chest and abdomen, with no clothing separating them. The baby is naked so that their body is direct contact skin to skin. Repeat. In this picture, the baby has been placed on the mother's chest and abdomen, with no clothing separating them. The baby is naked so that their body is in direct skin-to-skin contact with their mother. All babies should be quickly dried off as they are placed on the mother's skin and covered with a blanket or cloth to stay warm. Babies should be wrapped tightly after birth. Repeat. Babies should not be wrapped tightly after birth and that the room temperature is cold. All baby, repeat the whole slide. In this picture, baby has been placed on the mother's chest and abdomen with no clothing separating them. The baby is naked and so that their body is in direct contact. Repeat. In this picture, the baby has been placed on the mother's chest and abdomen with no clothing separating them. The baby is naked so that their body is in direct skin-to-skin contact with their mother. All babies should be quickly dried off as they are placed in the mother's skin and covered with a blanket or cloth to stay warm. Babies should be wrapped tightly after birth. Repeat. Babies should not be Repeat. Babies should not be wrapped. Repeat. All babies should be quickly dried off as they are placed in the mother's skin and covered with a blanket or cloth to stay warm. Babies should not be wrapped tightly after birth. If the room temperature is cold, cover the baby's head with a hat or blanket to reduce heat loss. A mother should hold her baby as much as possible for at least 1 hour after delivery, without interruption. She doesn't have to be lying down during this time, and she may be more comfortable sitting up or leaning back, holding the baby between her breasts and letting them respond naturally. Skin to skin must be practiced in a way that it may Skin to skin must be practiced in a way that it maintains the safety of both mother and baby. If a mother has received medications that impair her ability to practice skin to skin, she must be monitored closely by a healthcare worker. You should monitor both the mother's and baby's vital signs to make sure they will both remain safe and stable during the practice of skin to skin. The risk of not practicing skin to skin contact are as follows. There's a risk of infection from surroundings, less stable respiratory and cardiac signs, more difficulty learning to breastfeed, unstable temperatures. There's a shorter duration of exclusive breastfeeding, more maternal stress and less satisfaction with breastfeeding, more infant stress and more crying, less desire for mother to hold infant, less ability for the infant to smell mother's milk, and a greater pain, more crying during procedure. Here are two pictures of a baby in skin-to-skin contact soon after birth. They show the instinctive behavior and reflexes of a newborn baby in the first hour. In the top picture, the baby is just relaxing or resting. Most babies do this between 10 to 60 minutes. His mother should just let him take his time until he is ready to suckle. A few babies may also take between 1 hour to 2 hours. In the lower picture, notice that the baby has become more alert and is now opening eyes and staring. In the lower picture, repeat. In the lower picture, notice that the baby has become more alert and is opening his eyes and starting to respond to the smell of his mother's breath. At this point, repeat. In the lower picture, notice that the baby has become more alert and is opening his eyes and starting to repeat. In the lower picture, notice the baby has become more alert and is opening his eyes and starting to respond to the smell of his mother's breast. At this time, the babies will try to self-attach to the breast. Most babies slowly crawl toward the breast while they're skin to skin with their mothers. When a baby is on the mother's chest, the breast odor will encourage the baby to move towards the nipple. Provided a mother has not received medication during labor, she and her baby respond naturally to each other after birth. A healthy baby will self-attach to the breast and suckle well even without help. And if a mother and a baby are separated, the baby's pattern of behavior changes. It makes it more difficult to establish breastfeeding. Thus, it's important that all mothers are encouraged to let the baby suckle at the breast. The first time the baby suckles, the breast should be considered an introduction to the breast rather than a feed. There should be no pressure on the baby or the mother. The key is to provide encouragement in building a mother's confidence in breastfeeding. In special cases such as a preterm infants, early initiation of breastfeeding may be difficult for these infants. We encourage preterm babies to spend time at the breast as early as possible, even if they're not able to suckle well. This can help them to get to know the breast. And if the baby has the maturity to lick, root, suck, and swallow at the breast, they will do so without harm. So do not expect the baby to take a full feed at the breast immediately. This slide shows a mother who has just delivered. Do not leave a mother and a baby alone for the first hour of life. Repeat. Do not leave a mother and baby alone for the first hour of birth. Repeat. Do not leave a mother and baby alone for the first hour after birth. A healthcare worker should monitor the baby and the mother, and the mothers who are sleepy or under the influence of medications will require closer observation, and this will allow or ensure the safety of both the mother and the baby. Mother and baby should not be separated unless medically indicated. Routine procedures should wait, if possible, until afterwards, or if essential, can be performed during skin-to-skin contact. If a mother and baby have to be separated immediately after birth, skin-to-skin contact may be delayed but should take place as soon as their condition allows. Sometimes mothers or babies are unable to initiate during the first hour. Repeat. Sometimes mothers and babies are unable to initiate breastfeeding during the first hour of life, especially if the birth has been difficult in any way or through operation. They should be supported to provide skin-to-skin contact. Sometimes mothers and babies are unable to initiate breastfeeding during the first hour, especially if the birth has been difficult in any way or through operation. They should be supported by providing skin-to-skin contact longer than 1 hour and to breastfeed as soon as they are able. For example, in special cases after cesarean section. A cesarean section should not prevent the mother or her baby from having early contact. A mother who have had special Repeat. Mothers who have spinal or epidural anesthesia. Repeat. Mothers who have spinal or epidural anesthesia are generally alert and able to respond to their baby immediately. Skin-to-skin contact and breastfeeding can begin when the baby is ready. If the baby is not stable and needs immediate attention, skin-to-skin contact can be given when the baby is stable. Repeat. If a baby is not stable and needs immediate attention, skin-to-skin contact can be given when the baby is stable. If a baby is sleepy due to maternal medication, it is even more important that the baby has contact. Allow the contact to continue for longer until the baby shows interest in feeding. If a baby has to be in a special, repeat. If a baby has to be in a special care unit, encourage the mother to visit, touch, and care for her baby as much as possible. Often these babies are wrapped tightly in one position, and in these circumstances, care needs to be taken for mothers to recognize these feeding cues. So skin-to-skin contact should be encouraged, and the mother should hold her baby and put her baby to the breast. Effects of cesarean section on breastfeeding. Effects on the mother is likely to be frightened and stressed, be confined to the bed and restricted in movement, be deprived of energy to care for her baby, and receive anesthesia and analgesia for pain can affect the responses of both mother and the baby. The effect of cesarean section on breastfeeding on the baby is likely to be at a high risk of not responding to breastfeeding or of breastfeeding only for a short period of time, may have more breathing problems, need suction of mucus, may hurt the baby's mouth and throat, and baby can be sedate. Repeat. The need to suction mucus will hurt the baby's mouth and throat. Repeat. The need to suction mucus can hurt a baby's mouth or throat, and the baby can be sedated from medical medications. This ends session 6, Impact of Birth